The health department says the number of confirmed coronavirus cases in the Philippines remains at 3. So far, all are imported cases. But since there have been transmissions in other countries apart from China, the health department is ramping up efforts for the possibility of a local transmission in the country. Authorities say health systems are in place and isolation rooms have been identified.
We always have that at the back of our minds, that it will happen, that it can happen. That's why we're preparing our hospitals to make sure that kung dumami talaga yung cases and we might have to change strategies, dapat ready tayo.
The health department says it's going to be different when local transmission occurs, but priority this time is still on containing the virus.
Kapag ang bansa nagkaroon na ng local transmission, katulad ng Singapore, nagsishift na sila. Ang mga tao, kung ikaw meron ka kahit na NCOV ka pero mild lang, sa bahay ka na lang, ang ina-admit na lang yung mga severe cases. Tapos hindi na lahat tinetest. Pinipili mo na lang, tinetest mo na lang, yun talagang high risk.
Health officers recently focused their attention on 2 Filipino evacuees from Wuhan, China, a 1-year-old child and his 38-year-old relative after they experienced diarrhea, a less common symptom of the coronavirus.
In this case, walang cough and fever tong 2 patients natin, 2 repatriates natin, but they had diarrhea, so they were brought to JB Lingad for assessment kung persons under investigation sila. Pero since the test came out negative, na alam naman natin negative sila, they're still returned to the New Clark City to complete the 14-day quarantine period.
As of February 11, 238 were admitted for observation. 167 were discharged and 3 were confirmed cases. These figures now bring the overall number of patients under watch at 408. The World Health Organization says research teams are working towards finding more information about the virus.
We welcome the research community's efforts to develop a vaccine, but as our DG mentioned yesterday, in the minimum it's expected to take 18 months. So in the meantime, we need to do what we know works.
While there is no cure or vaccine for now, health experts say the best way to avoid nCoV is still to practice proper hand hygiene. Health experts also advise people to cover their mouths when coughing and to avoid large crowds. Trisha Tarada, CNN, Philippines.